Hello friends. We're going to discuss a very important topic, Attention Deficit Hyperactivity Disorder or ADHD. We'll talk about what it is, its symptoms, causes, and how to manage it. Let's dive in. ADHD is a neurodevelopmental disorder that usually starts in childhood and can continue into adulthood. It causes difficulties in focusing attention, controlling impulses, and regulating movements. ADHD can significantly impact social, academic, and work life. ADHD symptoms: attention deficit. This manifests as difficulty in maintaining focus on a task. It can lead to overlooking details, struggling to complete tasks, having trouble following instructions, and frequently losing or forgetting things. For example, a student might often make mistakes on assignments or find it hard to stay attentive during classes. Hyperactivity. This is characterized by being more active and energetic than usual. Symptoms include constant fidgeting or inability to stay seated, inappropriate running or climbing, and difficulty engaging in quiet activities. For instance, a child might constantly move around in the classroom and be disruptive to peers. Impulsivity. This involves acting without thinking or having sudden reactions. Symptoms include answering questions before they are completed, difficulty waiting for their turn, and interrupting others. For example, an adult might interrupt a meeting to speak out immediately. ADHD diagnosis and prevalence. Diagnosing ADHD usually requires a series of assessments, including psychological tests, clinical interviews, and observations. ADHD is quite common globally, affecting about 5–7% of people. Types and symptoms of ADHD. ADHD is categorized into three main types. Inattentive ADHD. Characterized by being easily distracted, not paying attention to details, having difficulty following instructions, and struggling to complete tasks. Hyperactive, impulsive ADHD. Characterized by excessive movement, inability to stay still, frequent talking, difficulty waiting for turns, and acting without thinking. Combined ADHD. Exhibits both inattention and hyperactivity, impulsivity symptoms. How to differentiate ADHD from other disorders. ADHD can be mistaken for other disorders like anxiety, depression, and learning disabilities. These conditions also cause attention and focus problems, but ADHD's distinguishing features are hyperactivity and impulsivity. For example, anxiety disorder, continuous worry and tension. People with attention deficit may also be anxious, but anxiety is more about future concerns. Depression. Persistent sadness and loss of interest. Depressed individuals may have trouble maintaining attention, but the primary symptom is emotional state. Learning disabilities, academic challenges. Learning disabilities cause difficulties in specific academic areas, whereas attention deficit affects overall focus. Dyslexia, difficulty reading and writing. Dyslexia is a specific learning disability affecting reading and writing skills, while attention deficit involves broader attention issues. Dyscalculia, difficulty with mathematical tasks. Dyscalculia is a specific learning disability affecting math skills, whereas attention deficit includes general focus problems. Living with ADHD. It's crucial for individuals with ADHD to receive support in their social and academic lives, regular treatment and therapy, and appropriate educational programs. Family and friends must understand their needs and provide support. Tips for living with someone with ADHD. Living with someone with ADHD can present challenges, but understanding and managing these can strengthen relationships. Here are some challenges and tips. Challenges. Attention deficit. Difficulty maintaining focus can lead to interrupted conversations and tasks. Hyperactivity. Constant movement can be disruptive, especially in calm environments. Impulsivity. Acting on impulse can cause sudden changes in plans or unexpected situations. Forgetfulness. Forgetting appointments and important events can lead to communication and planning issues. Organizational difficulties. Losing items or being disorganized can disrupt daily routines. Tips. Be patient. Patience is key. Try to understand their challenges and offer support. Communicate clearly. Good communication is essential. Clearly express your feelings and needs. Establish routines. Creating regular routines can help both you and the person with ADHD. Provide positive feedback. Acknowledge and praise their efforts and achievements. This boosts their motivation and confidence. Seek professional help. Professional support from a psychologist or psychiatrist can aid in managing ADHD. Managing and treating ADHD. ADHD can be managed using various strategies and treatments, including medication, behavioral therapy, and educational support. Medications help manage attention deficits and hyperactivity. Behavioral therapy offers techniques to improve focus and behavior. Educational support helps children perform better in school. ADHD tests. Diagnosing ADHD involves several attention tests. Here are some common ones. Stroop test, trail making test, TMT, continuous performance test, CPT. Practical tips for managing ADHD. Here are some practical tips for managing attention deficit and hyperactivity. Set achievable goals. Establish short-term, reachable goals and reward yourself for meeting them. Organize your workspace. Keep your area tidy to minimize distractions. Take short breaks. Use techniques like the Pomodoro technique and take short breaks to rest your mind. Limit technology use. Reduce the use of computers and phones to prevent distractions. Spend time in nature. Nature helps relax the mind and reduce stress. Mental exercises. Engage in activities like puzzles, Sudoku, and chess to keep your brain active. Conclusion: ADHD is manageable and can be effectively dealt with. You can make a difference in your own life and the lives of those around you. If you have questions or experiences to share, please leave them in the comments. Don't forget to subscribe to my channel and like this video.